Hi, my name is Dr. Pam Kreeger. I'm an associate professor of biomedical engineering at the University of Wisconsin-Madison, where my lab studies the process of metastasis in ovarian cancer. I wanted to say thank you to all of you who are participating in the ACS Virtual Relay for Life. This is obviously very different than the other Relay for Life events that I've had the chance to participate in the past. But it's just as important now as ever. We know that COVID has impacted all of our daily lives, and we know that it will impact cancer patients over the next few years, both patients now who have extra concerns due to their immune system, as well as patients that may not be getting the preventative care that they need and will be needing cancer treatments in the next few years. So I want to tell you a little bit about the research that my lab is doing. And it's been supported by the American Cancer Society all along the way. I did a PhD at Northwestern, and then I did a postdoc at MIT. And my postdoc was actually the first time the ACS supported me. Then I came to Wisconsin and started as an assistant professor. And one of my very first grants was an American Cancer Society grant here. It was a small little grant to get started. And then I got one of the national grants. And the work from that is the work that I'm going to tell you about, where we were looking at how tumor cells interact with macrophages, which are a cell in your immune system. It should be that the macrophages help to suppress tumors, but we know that in many cancers they don't. And so we were studying how specifically in ovarian cancer the macrophages impact tumor progression, and we identified a new pathway where the macrophages actually make the areas where the tumor cells are metastasizing in essence stickier, so making it easier for ovarian cancer cells to adhere, to spread, and to take over new tissue. And so now we're looking at that also in the reverse question is, how do the tumor cells make these macrophages the way that they are? Where in the process can we better intervene? Is it going to be easier to intervene to stop making pro-tumor macrophages? Or is it going to be easier to intervene against pro-tumor macrophages to slow tumor progression? And so one of those projects is now led on to an American Cancer Society Mission Boost grant in my lab, where we are doing some preclinical testing. And hopefully if our results pan out the way we would like, we will then move on to doing some early clinical testing at UW as well. So I wanted to say, again, a special thanks for participating, for supporting research. Research supports not only the careers of the research developers, so that they can move on and do the next study that they want to do. It helps support the day-to-day that we need, and it helps so that we are ready to face the next challenges. So I'm already seeing colleagues of mine starting to think about those next challenges that are going to come out of COVID, and our concerns that we may have patients who've put off care, so we're really going to have to be prepared for treating advanced cancers in a way we wouldn't normally want to do. So thank you for being there for us right now. Stay safe, keep your masks on, and try, as best you can to get through what we're all going through, and I'll hopefully see you next year at a real event. Thanks, bye.